Welcome to yet another edition of the Daily Report. It's Wednesday, February 16th here in Korea. Authorities have announced a record high in daily infections today, with cases surpassing the 90,000 mark. I have Kwon So standing by with the tallies here and elsewhere. So to start us off.
Sunny, let's start with that record high number of cases that Korea has reported this Wednesday. Now, 90,443 infections were counted in the past 24 hours as of 12 a.m. This Wednesday, and that includes more than 90,200 domestic transmissions, while 162 were categorized as imported cases. With that, Korea has surpassed 1.5 million cases in total, with a death toll at above 7,200. If we take a look at our graph, we see this jump here from the day before, with over around 33,000 more cases than the day before. And comparing the figure to last Wednesday, it is an on-week jump by more than 40,000 infections. And also the daily average in the past day now stands at above 60,000. Now, let's take a look at our map. As you can see, there are just two spots in the country with a lower population than other places that have a triple digit of figures. And Gyeonggi-do province now close to 28,000 infections. The capital Seoul over 18,800, and the city of Busan more than 6,000 cases reported in the past day. And meanwhile, the number of patients that are in severe or critical condition that has remained in the 300s now for the third straight day. On to our vaccination updates. So we've got a little over 9,600 people who got their first dose yesterday on Tuesday, and a little over 10,500 who got their second one. And onto the booster shot numbers, we've got more than 137,000 people who got their additional dose on Tuesday. That's now 58% of the nation's population. Moving to our global figures, around 2 million new cases were tallied in the past 24 hours as of noon Korea time, with close to 12,000 fatalities. And in the meantime, we've got, as we take a look here now, Turkey, which has now hit the 13 million mark in the past day, with over 94,000 new infections. And places that have still more than 100,000 cases are the U.S., Russia, as well as Germany. Germany posting some 177,000 infections. And those are the general updates that I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for now. Right, back here in the country, despite the fresh high in daily infections, authorities are largely expected to ease social restrictions, with details to be disclosed later this week. Shin Yeon joins me now. Yeon, welcome back.
Thanks for having me, Sunny.
Right, so let's begin with the upcoming fate of our restrictions, Yeon.
Well, a possible easing of measures is being reviewed by the government, which is going to inform the public on how it plans to do that this coming Friday. The rules most likely to change are the 6-person limit on social gatherings, which could be increased to 8 people, and 9 p.m. restrictions on the operating hours of cafes and restaurants, which could be extended to 10 p.m. And Prime Minister Kim Boo-kyum, in his comments on Wednesday, appeared to back this move. He apologized to the public for the hardships they've had to endure and laid out the government's top priorities in the drafting of new guidelines. Take a listen to what he had to say.
We will try to contain Omicron with new measures while alleviating as much economic and social damage as possible.
Right, yeah. Now, in response, I hear small business owners are saying the planned ease in restrictions fail to address their current hardships, right?
That's right. That's why on Tuesday, hundreds of small business owners filled Gwanghwamun Plaza in central Seoul to make their voices heard. They protested the government's social distancing measures, specifically the gathering cap and limits on operating hours. They said these restrictions are threatening to destroy their livelihoods.
Because we can't serve at night, we're living off what we make during lunchtime. Customers leave before 7 p.m. due to social distancing measures. We're losing motivation and hope.
So on Tuesday, a total of 10 organizations representing small business owners joined the protest. Just 299 were at Gwanghwamun, complying to the country's guidelines on large rallies that prohibit crowds of 300 or more. And this is as long as everyone is fully vaccinated, of course. The business owners demanded authorities to lift restrictions on operating hours and make more people eligible to receive financial assistance from the government. They said businesses with annual sales of more than 1 billion won, which is is roughly $840,000, should also be compensated for any losses stemming from COVID-19 restrictions. They also warned that if the government does not lift the 9 p.m. curfew, they would flout the rules and operate 24 hours from next Monday.
Right, I see. Moving on, Ian, what's the latest with regard to the sales of self-test kits and COVID-19 medication?
Well, Sunny, as of this Wednesday, authorities have completely banned the online sale of self-test kits. People can only purchase a maximum of 5 kits over the counter at convenience stores and pharmacies. To make sure enough supplies are on hand, the Ministry of Food and Drug Safety said they would distribute enough kits for 6.7 million people. They will be delivered to more than 51,000 convenience stores nationwide. Also, from this Wednesday, people will have easier access to COVID-19 medication. Caregivers of home treatment patients can now pick up their drugs from any pharmacy. Previously, they had to visit specifically designated pharmacies, as Hwa mentioned a day ago, and those who live alone will be able to get their medication through the Postal Service. However, Paxlovid will still only be available at 472 official dispensaries.
Right, yeah. Let's now expand our talk to include Soa, who has the latest official remarks with regard to our COVID-19 situation and the recent surge to above 90,000 cases on this Tuesday, right?
On this Wednesday, yes, Sunny. Until we reach the peak, which authorities currently see happening maybe by the end of the month, we are expected to continuously see unprecedented numbers. And an official at Wednesday's briefing cited KDCA Commissioner Chung Eun-kyung's recent forecast of daily cases to hit between 130,000 and even 170,000 later this month, meaning the 90,000 cases today may not impact the government's prediction for now. Now, here's official Son Young-rae with an explanation of the uptick today.
The weekend factor is once again playing a role in the rising number of cases on this Wednesday compared to Tuesday. Although it is a significant increase in absolute terms, percentage-wise, it's similar to what we've seen before between Tuesdays and Wednesdays.
He added that 2 and 3 days ago, around 300,000 COVID-19 tests were conducted given the weekend factor, whereas yesterday on Tuesday, the number of tests surged to around 650,000. Out of roughly 415,000 screenings at temporary test centers, the positivity rate was 20.8% as of Tuesday, meaning around 1 out of 5 people tested positive. While the number of serious or critical patients has recently risen to the 300s. The officials said that currently between 1,500 to 2,000 people in such condition can be handled. 27% of ICU beds nationwide are in operation as of this Wednesday. Close to 4,500 local clinics are now capable of conducting COVID-19 tests, and as of this Wednesday, the number of newly designated home recovery patients has risen by more than 20,000 to over 266,000. Medical facilities monitoring people who need more intensive management have been expanded to 685, and over 4,850 facilities are in charge of giving consultations to regular patients being treated at home.
Meanwhile, so as you mentioned back on Tuesday, education authorities have indeed shared their prevention plans for the academic arena on this Wednesday then?
They have, Sunny. Education Minister Yoo Eun-hae laid out the ministry's plan of how to start the new school year in a safe manner, and that would be at the beginning of March. And this amid higher chances of students getting infected with the highly transmissible Omicron variant, considering lower vaccination rates among the younger population, and also given the fact that the variant causes mild to no symptoms, particularly among younger people, which can raise the chance of unknown cases leading to cluster infections. So starting today, Wednesday, a special Omicron response period will be implemented until the 11th of March, led by the Education Ministry. What students of all grades from elementary to high school, as well as kindergartners, will have to get used to is swabbing their noses to get tested for COVID-19 twice a week. Minister Yoo said that this is a recommendation and that the government asks students to conduct these tests on Sunday and Wednesday evenings, but details can be decided on flexibly depending on region or individual schools. Meanwhile, these test kits will be distributed by the government for more than 6.9 million kids for free.
We have secured a total of 60.5 million test kits, which are enough to last 5 weeks, from the 4th week of February to the 5th week of March. We are making preparations to distribute them to students and faculty in schools when the new semester starts on March 2nd. 146.4 billion won from our education budget will be allocated to this effort, and each student will receive 9 test kits, while faculty members will receive 4.
And just to clarify, so self-testing for children is being recommended and not mandated then?
Exactly. It's part of the government's general strategy that's based on autonomy and responsibility, meaning officials highly recommend to get tested twice a week, but won't punish anyone for going to school untested. And speaking of autonomy, the education minister also stressed that individual schools can make their own decisions on prevention rules, with the ministry providing suggestions such as transitions into online classes.
Right, and the Seoul Metropolitan Office of Education, for instance, has already made its move. On Tuesday, school authorities in Seoul released their own set of guidelines.
Because the Ministry of Education allowed local education boards to have the final say, we tried to be as flexible as possible with the guidelines they suggested in the first place.
While kindergartners and first and second graders in elementary school are required to attend daily classes, students in other grade levels may have to take up virtual learning if their schools report cluster infections. The Education Office in Seoul has decided to secure more antigen test kits and will send quick reaction teams to kindergartens and elementary schools reporting 5 or more infections to conduct PCR testing. And they added if 3% of all students at a school are infected, they would reduce the number of in-person classes. This will also be triggered if 15% of the students are absent because they've either been infected or in self-isolation. And a total of 5,764 students in Seoul have been infected with the virus from February 7th to the 13th. And this was nearly double the figure that was reported the previous week.
Right, and staying with such numbers, so what is the actual proportion of COVID-19 infections affecting the young?
Well, the latest government data, Sunny, shows that those aged 18 account for, under 18 that is, account for 27.9% of total infections. And to put that into comparison, those in their 60s and above make up 11.4%. So we can really see how earlier in the pandemic days here in Korea, we had most of the elderly population that had a higher percentage of infections. And now we're seeing that this is more spreading to the younger population.
I see. All right, so thank you very much for those numbers and the latest for this Wednesday. Ye-lim, thank you as well, and see you on Thursday.
Thank you so much.
Russia says some of its troops, that is, are moving back to their base after drills near Ukraine. The U.S. claims it has yet to confirm the move itself. Our Kim Yo-san reports.
Russia says it's pulling back some troops from the Ukrainian border. Speaking to reporters on Tuesday following a meeting with Germany's Chancellor, Russian President Vladimir Putin said some soldiers are returning to their bases after completing drills near Ukraine. Putin also stressed that Russia does not want a war in Europe, adding he is prepared to continue dialogue on security issues with the West.
Do we want it or not? Of course not. That is why we have offered our proposals to start a negotiation process, which should lead to an agreement of providing equal security for everybody, including our country.
Responding later from the White House, U.S. President Joe Biden said Washington had not yet verified that Russia had started withdrawing troops. He also warned that, quote, an invasion remains distinctly possible. Biden also stressed that Russia will be met with overwhelming international condemnation if it invades Ukraine. He added that if Russia carries out further military aggression, the human cost would be immense for Ukraine, and the strategic cost for Russia would also be immense. This comes as President Biden agreed with his French counterpart on the need to verify Russian claims that it was beginning to pull its troops back. Against his backdrop, America's top diplomat told his Russian counterpart that Washington seeks, quote, a verifiable, credible and meaningful de-escalation of tensions. U.S. Secretary of State Antony Blinken added that the U.S. has ongoing concerns about a possible invasion of Ukraine by Russia. Meanwhile, Ukraine's defense ministry website went down Tuesday due to what its government claimed was a massive cyber attack. This comes after some 70 Ukrainian government websites were disabled in January, an attack that Kiev said Russia launched. Kim Hye-san, Arirang News.
On the local front, findings for the month of January show the rate of employment rising at its most rapid pace in over 2 decades. Analysts are linking this reality to a low base effect. Kim Sang-min explains.
South Korea saw the biggest on-year job growth in 22 years in January, bouncing back from low numbers the previous year. Statistics Korea said on Wednesday that the number of workers in the country came to around 26.95 million last month, up 1.14 million from a year ago. That was the largest on-year job growth since March 2000. The bumper figure comes as the country saw huge job losses the previous year, losing almost 1 million jobs due to the fallout from the pandemic. The solid gain in January could be also attributed to the continuous economic recovery trend, mostly around sectors that were not hit hard by the pandemic.
There was, of course, the base effect, and digital sectors are also adding more jobs. Other sectors benefited from the robust exports.
Another positive sign was that for the first time in 19 months, all age groups saw job gains. Those aged 15 to 29 added the largest number of employees since February 2000, while people in their 30s saw their first gain in 23 months. By sector, the health sector added 250,000 more jobs amid the spread of the virus. Omicron has taken its toll on the retail sector, though, with 56,000 fewer workers in the sector in January compared to the previous year. Kim Sang-min, Arirang News.
Also, within the local labour market, about 50% of workers, in particular women, believe the 52-hour workweek cap has enhanced labour practices. Our Ian Jin has more on this latest finding.
It was in 2018 that the South Korean government began enforcing a 52-hour workweek system under a revision to the Labor Standards Act. The updated rules were phased in from July of 2018, starting with companies that have more than 300 employees. And by July of last year, only businesses with fewer than 5 employees remained exempt from the rules. On Wednesday, the Korean Women's Development Institute released a research report on the effects that the 52-hour workweek has had on the labor force. This research was based on a survey conducted on 303 female workers and 301 male workers who were employed at medium-sized companies with more than 100 employees. The data was collected over a 6-week period from September of last year. The results revealed that it was women who were more satisfied with the overall effects of the system. When asked, roughly 67% of both women and men responded that there was no work after hours following the implementation of the 52-hour workweek cap. And some 53.8% of women and 54.5% of men said they did not have to engage any work during holidays. The survey further showed that there was more self-will in deciding whether to work outside work hours or during weekends and holidays. 45.2% of women responded that the new system helped with their work-life balance. 43.5% of men also thought so. And restrictions on working hours have also resulted in shorter meetings and fewer work dinners. Overall, the response from women was more positive than men with regard to the shortened work week. Researchers said that the findings show the rule has indeed reduced the overall work time for both men and women, and also reduced the gender gap in terms of those who worked extra hours and on weekends. Previously, men worked longer hours. Ian Jin, Arirang News.
As for the latest from the Winter Games over in Beijing, 2 of Team Korea's female figure skaters are advancing to the free skating round slated for Thursday. Our Choi Min-jung has that story.
South Korea's figure skaters Yu Young and Kim Ye-lim made strong debuts at the Winter Olympics, both finishing in the top 10 in the ladies' singles short programs on Tuesday. Yu ranked 6th after scoring 70.34 points. Though she did not break her own short program record, she received the third highest score in the Olympics for a Korean national, following figure skating legend Kim Yeona. Yu performed to whirling winds. She began with a triple axel, but was marked down as her jump was judged to be under-rotated. Meanwhile, Kim finished in 9th place with 67.78 points. She performed to Love Dream, a piece that was recommended by Kim Yeona. Kim opened with a clean triple Lutz triple toe loop. She also performed a double axel and a triple flip without trouble. Following their solid achievements, the pair will compete in Thursday's free skating segment. Normally, only the top 24 out of 30 skaters get to advance to free skating. However, this time, a total of 25 contestants will compete in the next segment, as the International Olympic Committee decided to allow one more spot if Kamila Valieva were to seize the top spot. Valieva, who has been the subject of controversy for participating in Tuesday's competition despite failing a doping test, clinched first place with 82.16 points. The IOC also decided not to hold flower and medal ceremonies should she finish amongst the top 3 skaters. Choi Min-jung, Arirang News.
Let's take a look at what's going on in the world now. Belgian employees will now be able to work full-time 4 days per week. The Belgian federal government unveiled on Tuesday a new labor agreement aimed at bringing flexibility to the rigid labor market. The move is optional, which means employees who make the request will be able to work up to 10 hours per day instead of the maximum 8. This would allow staff to work 1 day less per week for the same pay. Belgians will also be allowed to choose to work more during 1 week and less the following one, allowing for people to better manage their work life. The latest agreement also introduces the right to disconnect after normal working hours for companies with more than 20 employees, meaning no work-related emails outside of work hours. A historic decision on Tuesday, as gunmaker Remington Arms has been ordered to pay $73 million to the families of 5 adults and 4 children killed in the 2012 Sandy Hook Elementary School shooting. Along with the massive sum, the company will also release all discovery and disposition material to the public. The settlement is to be paid through insurance policies. In December 14, 2012, 20 students and 6 adults were killed when a gunman used a Remington Bushmaster AR-15 rifle to shoot his victims. The settlement marks the first time a gunmaker has been held responsible for a mass shooting in the United States. The UK's Prince Andrew reached a settlement with Virginia Giuffre on Tuesday after she accused him in a lawsuit of sexually abusing her more than 2 decades ago when she was just 17 years old. In a joint court filing, lawyers for Giuffre and Andrew said the settlement includes an undisclosed sum, adding that Andrew intends to make a substantial donation to a charity of Giuffre's choice in support of victims' rights. Last August, Giuffre sued the Duke of York, alleging he assaulted her at a time when she was being trafficked by the late financier and convicted sex offender Jeffrey Epstein. Space tourism company Virgin Galactic announced Tuesday that it will begin selling tickets for joyrides to the edge of space to the general public. And the cost per ticket? $450,000. Starting Wednesday, members of the public will be able to reserve a seat on an upcoming space flight. During the 90-minute flight, passengers will reach an altitude of more than 80 kilometers while experiencing roughly 4 minutes of weightlessness before returning to Earth. Reservations for the space flight also includes several days of training. Lee Seung-jae, Arirang News.
A growing number of COVID-19 patients are being asked to take care of themselves at home as authorities seek to better accommodate those at high risk. We have more on this new treatment strategy in this report.
With a rapid surge in COVID-19 infections, the cumulative number of people getting treatment at home surged to roughly 230,000 as of this Monday. The government says the number of people recovering from home is on pace to the 1 million mark by early March.
Because of a rapid surge in the number of COVID-19 patients here in South Korea, health authorities decided to shift its focus of at-home treatment to high-risk patients only. So how exactly should you deal with home as well as self-treatment once you test positive?
After a positive result, the Public Health Center will send you a URL via text message where you can self-record your personal information, pre-existing conditions, presumed infection routes, and contact information as part of self-epidemiological investigation. Based on the provided information, the health center will categorize patients into two groups, the intensive management group or the regular management group. Patients over 6 years or older or in their 50s with pre-existing conditions will qualify for the intensive management group. Patients in this group will receive daily checkup calls as well as at-home treatment kits. Previously composed of 7 items, now consist of only 4 items, including fever reducers, a thermometer, a pulse oximeter, and disinfectant.
So all the patients other than those who are in intensive monitoring group are classified as regular monitoring group. They have to go self-quarantine for 7 days from the date of testing, and during that time, they have to self-monitor their health.
If you are subject to self-treatment, you're recommended to prepare common home remedies for a cold, such as a fever remedy, anti-inflammatory medications, and multi-symptom cold and flu medicine. High fever that's lasting more than 3 days and difficulty breathing should be considered as warning signs. Other symptoms include chest pain, runny nose, sneezing, and leg swelling. Also, if you feel sick, even after 5 to 7 days, you need to see a doctor. Treatment can be received free of charge at government-designated hospitals such as respiratory clinics, and the list can be found on the Health Ministry's website.
With a soaring number of patients that are undergoing at-home treatment, the role of local clinics has become as important as that of the government-designated hospitals.
그렇지만 상태가 안 좋아지시게 되면 언제라도 동네에 있는 스스로 다니시던 그런 병의원에 비대면 진료가 가능하도록 되어 있습니다.
Then how are things look in local clinics? This hospital in Seocho-gu district in Seoul has been in charge of managing at-home treatment patients with a new monitoring system that asks local clinics to monitor patients.
환자분들한테는 이 생활치료 앱이라는 게 있습니다. 이 앱을 설정을 해서 여기와 로그인이 되면서 자기의 증상들을 갖다 여기다 다 이제 입력을 할 수 있게 됩니다. 그러니까 병원에서는 이제 이걸 보고 매일 보면서 이분들이 어떤 증상이 있으면서 또 어떤 문제가 있는지를 갖다가 살펴보고 아침마다 이제 콜을 하면서 이제 어떤 문제가 있으신지를 갖다 보고 그리고 이제 해결해 드리는 거죠.
This hospital had been in charge of taking care of teen patients since the 3rd of this month, but only after a week. With the newly introduced system, now it is overseeing high-risk patients undergoing at-home treatment from the 10th. Rapid and sudden changes in the government's measures against the Omicron variant that is fast spreading are causing significant confusion among medical staff and citizens.
사실상 이제 동네의원의 역할을 중요하다 강조는 하셨는데 실제 그것이 적용되기까지는 동네의원의 현실에 맞는 그런 지침의 전향적인 개선이 좀 필요하고요. 그다음에 병원은 중환자 또 입원 환자 응급실 등을 담당하고 동네의원은 재택치료 환자 위주의 비대면 진료를 하게 된다면 역할 분담이 잘 될 것으로 생각하고요.
Experts are saying it would take at least 2 months for the Omicron wave to pass its peak. And remember, this is the time when we need to thoroughly exercise quarantine measures. This has been 신새벽.
A new academic year begins for Korean students come March, and relevant officials are seeking to ensure a safe learning environment as well as an effective treatment strategy for those infected. For more on these efforts, I have Professor Kim Moon-kyu from Yonsei University. Professor Kim, welcome back.
Thank you for having me.
Meanwhile, I have Dr. Alice Hyung-Dan at Ms. Medi Women's Hospital live on the line. Dr. Dan, it's good to see you again.
Good afternoon.
And also joining this session virtually is Professor Peter Chin Hong at the University of California, San Francisco. Professor Chin Hong, it's a pleasure to speak with you again.
Always a joy, Sunny. Thank you.
Right, Professor Kim, we'll start here. Let's begin with the risks faced by children here in Korea in light of Omicron.
If you ask me whether children are more susceptible or not, my answer is yes and no. You know, at the beginning of the pandemic, this coronavirus was not that a big problem with children. So they started with a low incidence in children. But now, as the adults are all vaccinated, the main population getting infection is moving to the younger generation. So if we compare with adults, children are relatively susceptible right now. So it's in a confusion, so it is too early to draw a final conclusion. But one more thing I would like to mention is, as we see many patients in the hospital, they come and they do not come because of Omicron. They come with other reasons, and they are accidentally found to have positive results of coronavirus, which must be Omicron. So that means the increased instance of hospitalization in children might happen like this way. So we have to see and look whether they have severity or not. If it's not, we don't have to worry about the situation until now.
Right, I see. Dr. Tan, some believe children and teenagers will account for about 30,000 daily infections starting late this month. Do you share this outlook?
Yes, that's certainly possible. If we look at the overall incidence of COVID-19 in the children and adolescent population, that actually accounts for the largest incidence rate compared to all other population groups in our country. The cumulative incidence overall of COVID in our population is 2,800 per 100,000 people, whereas for children and adolescents, the incidence rate is now about 4,000 per 100,000 population, so about 40% higher in children and adolescents. Over the last 4 weeks, there has been a significant increase in the absolute number of cases in children aged 18 and younger per week. If we compare the third week of January, there were about 9,500 cases over that 1 week period, pediatric adolescent cases. During the second week of February, that number per week had increased to 76,870 per week, a huge increase, an 8-fold increase in new pediatric cases over a 4-week period. And so now that children will be back in school starting March 2nd, I think that we can anticipate an even higher number of pediatric COVID cases.
Right. Meanwhile, over in the US, Professor Chin Hong, a study by the CDC published on Tuesday, I believe, showed COVID-19 hospitalizations among children rose in the presence of Omicron, especially for those aged below 5. Do tell us more about this.
Yeah, so like Professor Kim was saying, it really reflects who is not vaccinated. And again, many kids were coming into the hospital for many other reasons. Kids come into the hospital during winter time. And because we do universal screening at the time they come into the hospital, they were diagnosed with COVID, didn't necessarily come in for COVID. Of course, kids come in for other reasons as well with COVID. And we found out in the pediatric population, and a lot of them get a lot of inflammation in the large airways. So it sounds like croup or something in the pediatric population. But nevertheless, 4 times more kids hospitalized in Omicron versus Delta. Not all of them really had COVID, were ill with COVID. And is probably a reflection of high rates of obesity and other comorbid conditions in the American pediatric population, say compared to the UK.
Right, I see. Now, here in Korea, though, Professor Kim, authorities have yet to note an alarming surge in the number of COVID-19 hospitalizations among children, and most of them are being treated at home. Having said that, what can you tell us about their treatment regimen at home?
Well, it's something not easy, not we are accustomed. I mean, even the doctors and even the patients, they're going to phone call the cases twice a day, and this kind of medical service is quite new, maybe the first time in Korea for pediatric age group. I don't know whether we have enough manpower, experienced manpower to cover all the needs, and the other phone is going to work properly day and night without any delay or something. Because as I work in the emergency department, I got a lot of phone calls, and it's really frustrating for them and also for me. And we have to understand that there are more limitations in pediatric age group. So if I say pediatrics is one of the most difficult area for developing telemedicine, so definitely we're going to need some revisions of this policy in the near future.
Right. And for the sake of comparison, Professor Chin Hong, do tell us a bit about the standard treatment procedure for pediatric COVID-19 patients over in the U.S.
So I think it's supportive care as much as possible. And part of the reason is that many of the clinical trials that we take for granted, remdesivir, steroids, etc., they were all mainly done in adults. So we have to extrapolate the results to children. So it's really done on a case-by-case basis for the most sick pediatric patients. For example, remdesivir, really FDA approved for above the age of 12, but under the age of 12, it's used on a case-by-case basis. The same as with some of the other anti-inflammatories and steroids. And of course, in the outpatient setting, molnupiravir is not indicated for kids under the age of 18 because of the effects on fertility and on young growing bones. And of course, Paxlovid is only above the age of 12. So we're very limited when we come to both data as well as potential agents for treating kids.
Right. Dr. Dan, authorities on the local front, meanwhile, have secured 135 hospital beds in the Greater Seoul area for pediatric COVID-19 patients. And like Professor Kim mentioned, there are efforts to include children's clinics in the country's telemedicine campaign. What are the implications of these efforts?
Well, first of all, telemedicine, as was mentioned, is very new in Korea, and it is a bit of a controversial issue. If we remember back in August 2020, there was actually a nationwide strike among doctors in training after we tried to implement telemedicine. And I remember during the MERS outbreak in 2015, I tried to implement telemedicine in our hospital, and I was actually met with a lot of resistance initially. However, it was a way that we could contact and stay in touch with our patients during our 1-month hospital shutdown during MERS. And that's what telemedicine is all about. It's about access. Patients could have difficult time accessing hospitals during COVID, and doctors can access their patients who are in need of medical guidance during acute COVID. In the case of Omicron, it's also about safeguarding hospitals and safeguarding healthcare workers against infection with COVID. So I think expanding telemedicine is the right direction to move in. In terms of securing additional hospital beds for pediatric patients, it is true that most children with COVID-19, they will recover. However, we need to be mindful that there are still vulnerable populations within the pediatric group, children with diabetes, children with immunocompromised states. And so we need to prepare hospital surge capacity to take care of these children. And then also, of course, there will be children who are diagnosed incidentally with COVID-19, as Professor Kim mentioned. And so we need to have isolation beds ready and prepared for these children who come in with other acute conditions, but who are incidentally found to have COVID-19.
And speaking about being mindful, Professor Kim, what COVID-19 symptoms do parents need to be aware of while taking care of their children at home?
Well, it's happening from a small baby less than 1 month to a teenager. And if I start from the infants, usually they just have fever. And if it's combined with poor oral intake, baby can easily be dehydrated. So caregivers have to check the diapers and see whether the urine output is decreasing or not. If it's decreasing, it's a worrisome. And toddlers may have more variety of symptoms like coughing, fever, irritability, vomiting, diarrhea. Again, dehydration is the main problem we have to prevent. And let them drink more water than usual. And food should be something easily digestible. And children who can express their will, they have more easy to understand their situations. So as you might have noticed, this COVID-19 symptom, maybe the Omicron, is just like a common flu or intestinal flu. So hydration is very important, and the children might have to use a separate room in home, inside the house. And family members should keep about 1 meter distance from the patient, and we might have to limit their movement inside and open the windows for frequent ventilation, and some say even sunlights are good for health to recover. But there is a high risk, as Dan mentioned. In children, severe obesity seems to be a high risk, and kids with diabetes, congenital heart disease, with epilepsy, chronic lung disease. And one more thing from the recent report from Journal of Pediatrics, feeding tube dependency is another risk factor. So if the patient belongs to this criteria, I strongly recommend to have vaccination. And the third issue is about the caregivers. Somebody's going to care for the baby at home, right? So we have to designate one person who's going to be responsible until the recovery, and you should not change the person. The caregiver should wear a mask, wash hands every time the person has a contact with the children, and the patient should not share cup or towel or some dishes like that. If possible, we have to control the waste products, and I think no visitors should be allowed. And the caregivers have to know the phone numbers of the clinics they can contact with.
Right, and moving from treatment back to vaccination, Professor Chin Hong, on the vaccination front, what has been disclosed about Pfizer's ongoing clinical trials with regard to its vaccines for toddlers from 6 months to children aged 4?
Yeah, so I'll give you a little bit of history, Sunny. So first, a few weeks ago, we got the results of the trials, and it showed that between 6 months and 2 years, the dose of 3 micrograms seemed to do quite well with a 2-dose regimen. But in the 2 years to 5 years, it didn't do quite as well with 2 doses. So they said, let's go back to the drawing board, let's give a 3rd shot and look at that efficacy. But meanwhile, Omicron was raging, and there was a lot of thought that maybe we can start the vaccine series with 2 shots in the under 5 and maybe wait for the data for the 3 shots, assuming that it will work. Turns out that that was controversial, and then last Friday, the FDA said, wait a minute, we'll wait 2 months for the full 3-dose series before, approving it or, having this reviewed by the Scientific Advisory Board. And at the same time, Omicron is going down very dramatically, so there was less pressure to do it. And I think a lot of people agreed with that because, again, you want to have the best foot forward to increase trust in the people who would then bring their kids to get the vaccine.
Right, of course. Dr. Dan, some 20 countries, including the US, have granted the green light for COVID-19 vaccinations for children aged 5 to 11. Do you suppose Korea should do the same, that is, especially as Professor Kim mentioned, those with pre-existing health conditions?
Yes, and we should be mindful that COVID-19 will be an endemic disease. We cannot predict the future virulence of COVID-19. We hope that it will become milder, but there is no guarantee. In the near term, COVID-19 will remain a potentially fatal disease among children. And the best way to protect our children against this infectious disease, just as we protect them against influenza, chickenpox, and the measles, is through vaccination. We should also keep in mind that long COVID is up and coming, it's an emerging public health crisis. Researchers have found that having had COVID-19 is now a major risk factor for cardiovascular disease. And so I think we need to protect our children against having a risk factor for heart disease and stroke and blood clots, which is what long COVID could be in children. There are so many unanswered questions. Now, I do have a sense of conflict, I would say, because I do know that there are many people around the world, including healthcare workers, who have not even received one dose of a COVID-19 vaccine. And so I think that just means we need to work harder. We need to work harder to make sure we have global equity. But vaccinating our children, I don't think should be an either-or issue. I think we need to protect them against COVID-19. And the recently published phase 2-3 clinical trials that showed that 2 doses of 10 micrograms of the Pfizer vaccine spaced 21 days apart, that this is safe and efficacious immunogenetic in children between 5 and 11 years. And so I support vaccination in this age group.
Right. And staying with vaccination, Professor Kim, the rate of COVID-19 inoculation among teenagers here in the country, that would be those aged 13 to 18, stands at 81%. Having said that, what would you like to share with those who have yet to receive their vaccines?
Well, yeah, as everybody now, I think, understand children with high-risk health conditions should have vaccinated. And I recommend we can provide more safe and more effective one. And actually, I'm waiting for a clinical study in children age group with Novavax, and that make me remember of the basic vaccine schedules we already had before this pandemic, and children should not miss their basic vaccination schedule. We should continue with that, and I hope that we can add on a safe and effective corona vaccine also.
Right, hopefully. Dr. Dan, as my colleague Soa mentioned earlier, school children and faculty members are being recommended to take rapid antigen tests twice a week come March as part of COVID-19 prevention efforts within the academic arena. Having said that, what are your thoughts on the practicality of this particular measure?
I think it's completely practical. I mean, this is a strategy that's been in use in schools and universities in the United States for over a year, and it's been successful. Doctors at Stanford, Harvard, the University of Maryland, Brown University, Johns Hopkins University, they recently published a report looking at different testing strategies to help facilitate in-person learning for students. And what they found was a weekly universal testing protocol prevented approximately 50% of in-school transmission. And they also stated that this type of universal testing would lower projected societal costs compared to hybrid or remote schooling. Also, they found that the cost per infection averted declined as community transmission increases. And that's exactly what's going on in our country right now. So I think test to stay protocols and also universal screening, weekly screening protocols are effective. They're practical, they work, and we talk a lot about the layered approach to fighting this pandemic. This type of testing protocol is one more tool that we can use to help keep our children safe and to keep schools open.
Meanwhile, Professor Chin Hong, over in the US, given the dramatic decline in Omicron cases in recent days, I understand authorities there are looking to ease restrictions, including the mask mandate within school grounds. What are your thoughts on this?
Well, I think it's understandable that people are feeling frustrated. I think in California, which has one of the biggest school systems in the country, we're being a little bit more cautious. So the school mandates are still going to be in place and are going to be readdressed in the next 2 weeks. And it has been said, I think wearing a mask is such an easy thing. It's acceptable by kids. And because California had closed their schools for in-person instruction for so long, there's a lot of pressure to keep these schools open as much as possible. In other states that have opened and closed, there's probably a little less pressure. So now only 7 states and the District of Columbia still have school mandates for kids. So the best advice, build a wall of immunity, vaccinate all of the people around those kids to make it as safe as possible for the children who are still going to school, and we want them to stay in those seats.
Right, we do. And Professor Kim, very briefly speaking, let's end today's session with a few words of advice for children with regard to efforts aimed at tackling Omicron.
Well, I would like to ask for the government, not for the children. As I was on duty this morning, it's very difficult. Emergency departments are frequently closed because we have confirmed cases and we have to disinfect all the areas. So as the Korean Pediatric Society recommended, we need more manpower to prepare for a high rise. I think we might face more higher cases in the following weeks. So I wish that we can have some drastic measures. We can help these confirmed cases dealing with those health issues.
Right, proactive efforts to bolster our workforce then.
Yeah.
Professor Kim, as always, thank you very much for your
Thank
thoughts.
you.
Dr. Dan, thank you for being with us today. And Professor Chin Hong, always in the US, thank you for your insights.
Thanks so much.
Right, authorities believe the daily tally will continue to rise in the days ahead, so do seek to abide by basic prevention guidelines. Thank you for watching.
When the lantern of wisdom and mercy lights up, a traditional